So good day, I'm Ivan Clarence MENDAROS, a second year student from Davao Doctors College, and now I'm going to demonstrate the proper way to perform the CPR on an infant up to 1 year of age, and also it will include how to respond to a potential choking situation with an infant. So let's start with the basics. CPR is a short for cardiopulmonary resuscitation, which is the action of pushing hard or compressing the chest and giving breath to an infant. CPR will keep oxygen and blood flowing throughout the body of an infant whose heart has stopped beating, and many people are afraid to start CPR for fear not knowing the proper CPR technique. Now let's get started. If you find an unresponsive infant, first you check for the responsiveness by tapping the foot and shouting the baby. Okay, baby, are you okay? Baby? Okay? Did the baby move, blink, cough, or show any signs of life? Did the baby respond? If no, yes. If no response, if yell for help. Okay, help! The baby is not moving and baby wake up. Okay, help! I can. And if someone there, tell them to call 911. Okay, you with a green shirt, call 911 immediately. Okay, if you're all by yourself, you will need to do 5 cycles of CPR and then call 911. Then don't worry about the 5 cycles. You will have to learn how to do them during this video now. So move the clothes out of the way so you can see. So you can see the infant's chest and belly scan for breathing from the head to the belly for 5 seconds, but no more than 10 seconds. Is the chest moving? Is the baby breathing? Could the baby only gasping? And gasping is not normal breathing. It's a rapid sucking in of air and is not normal breathing. If the baby is gasping or not breathing, the baby needs CPR. To start the CPR, we'll need to give 30 compressions and 2 breaths again and again until the infants wake up and begins to breathe, or someone can take over for you. Remember, if you're alone, you'll need to give 5 cycles of CPR, then call 911, then put your phone on a speaker, then the emergency staff can communicate with you. Then let's start with the 2 compressions. First, place your hands 1 finger breadth below the mid nipple line over the lower half of the sternum of breastbone. Place the other hand on the forehead to help the infants keep airway open. We're going to draw a line right across the nipple line to the center of the chest. Lift your top finger, 1 hand on the forehead, and you're in position to start CPR. Compress or push down at least 1/3 the depth of the chest and for about 1.5 inches or until you feel resistance. We're going to compress about 30 times at least at a fast rate. We're trying to achieve about 100 to 120 compressions per minute. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Be sure to allow the chest to rise up to normal position. After each compression, count out loud. After 30 compressions, you will need to give 2 breaths, keeping 1 hand on your infant's forehead, placing 2 fingers on the bony part of the infant chin so you can tilt the head backwards so the nose points to the ceiling. To give your 2 breaths, you'll need to cover the baby's mouth and nose with your mouth, and you're going to breathe in just until you see the chest rise. Okay. Did you see the chest rise? If the chest didn't rise, reposition the head and try your breath again. If you're alone, complete 5 cycles of CPR, then call 911. Tap the foot of the baby. Baby, are you okay? Okay, were there any signs of life? So call for help. Help! The baby is not moving. So you in the green shirt, call 911 immediately. So scan for signs of breathing. Go for from the head to belly for at least 5 seconds, no more than 10 seconds. Is there anything breathing? Is the chest moving? Is the baby only gasping? Remember, the gasping is the quick entry of air which is not normal breathing. If only gasping or not breathing, this baby needs CPR. So you're ready for your hand position for CPR. One hand on the forehead, start compressions. 30 compressions, 2 breaths. 2 fingers on the chin and back of the head and slightly cover the mouth and nose, 2 breaths, and lifting your mouth slightly between each breath. So back on the chest, compression in cycle. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So you will keep on doing this over and over again until the baby wakes up or someone can take over for you. And if you were alone at this point after 5 cycles of CPR, you would have called 911. And that's all. Thank you.